neonatal reflexes. These are called as primitive reflexes. Primitive means necessary for survival. Human being के एजेस एंड स्टेजेस रहते हैं, जैसे बटरफ्लाई के रहते हैं, अंडी, अवी मीन्स लार्वा, कोश मीन्स प्यूपा एंड बटरफ्लाई, वैसे ह्यूमन बीइंग के भी रहते हैं. न्यूबॉर्न, फीटस, infancy, toddler, preschool, school age, pre-adolescent, adolescent and adult. Adolescence में भी early, mid and late adolescence 3 टाइप किए जाते हैं. Why it is important? Because at every stage, anatomy is different, physiology is different, pathology is different, pharmacology is different, everything is different. The structure, function, everything is different. So, understanding pediatrics means understanding child's at that age, all science of anatomy, physiology, pathology, pharmacology, everything of that age. So, they are primitive reflexes, also called as neonatal reflexes. They are involuntary reflex actions of CNS. Involuntary reflex CNS. They are not under voluntary control of the newborn's brain. They are present in childhood, absent in healthy or neurologically intact adults. If the baby is not neurologically intact, the neonatal reflexes persist. While studying the neonatal reflexes, we have to know name of the reflex, how to elicit it. The stimulus to be given to elicit that reflex should be known. Interpretation of that reflex should be known to us. We have to study that. Normal range of disappearance we should know. Beyond what age it is abnormal if the reflex persists, that we have to know. So these 3 things we have to study about neonatal reflexes. They are present during normal development. These reflexes are slowly inhibited. They don't go away. They are inhibited. They are primitive reflexes. They are designed by nature to protect the life. But they are inhibited by frontal lobe of the brain. Upper motor neuron has inhibitory control over lower motor neuron. When this inhibitory control is lost due to disease or anything, pathology, the reflexes are exaggerated. Tendon reflexes are exaggerated. Babinski's the plantar reflexes are void. These reflexes are slowly inhibited by the frontal lobe of the brain as the brain matures. That means as the brain gets myelinated, as the neurons get myelinated, means mature. These reflexes are inhibited, not lost. this inhibition replaces them with voluntary motor activities. Newborn can move the hands and legs. There are spontaneous body movements of hands and legs of a newborn who is awake. These spontaneous body movements are involuntary. They are not voluntary. They are purposeless. But this spontaneous body movement is also a neonatal reflex. These reflexes are replaced by voluntary motor activities. As the child brings his hand towards some object, thinner grasp, palmar grasp and pincer grasp. First thinner grasp, then palmar grasp, then pincer grasp at night, चिमूट से पकड़ना. But certain neurological diseases can relax the neonatal reflexes. Cerebral palsy is a disease of developing brain. Cerebral palsy is a disease of developing brain. Once the brain is developed, the insult can cause neurological deficit, signs, symptoms, but it will not cause cerebral palsy. That's why hypoxic ischemic encephalopathy, hypoxic ischemic encephalopathy causes cerebral palsy. Bilirubin encephalopathy causes cerebral palsy. Neonatal hypoglycemia can cause cerebral palsy. Hypothermia can cause cerebral palsy. Metabolic disorders can cause cerebral palsy. Neonatal meningitis encephalitis can cause cerebral palsy. But older children encephalitis meningitis may cause sequelae, not cerebral palsy. In cerebral palsy, the neonatal reflexes reappear. Even if they are lost, they can reappear. Reflexes are classified according to level they are controlled. Reflexes are classified according to level they are controlled. Cortical reflexes. There is a list of reflexes, but I will give you only one example so that you remember. List of 100 reflexes confuses everything. If we remember few common of each category, then you understand it and you remember. So the cortical reflexes are equilibrium reactions. Cortical reflexes are equilibrium reactions. Midbrain reflex, parachute reflex is typical midbrain reflex. Brain stem reflex, tonic nape reflex, that is brain stem. Spinal reflexes, plantar grasp, palmar grasp, circling, rooting, walking, these are spinal reflexes. Types of primitive reflexes are general body reflexes. First I give you classification according to level they are controlled. That is anatomical. Now I am giving clinical types of reflexes. Whole body reflex, general body reflex. Morrow, startle, plantar grasp, palmar grasp, walking, stepping, asymmetric tonic neck reflex, symmetric tonic neck reflex, Babinski, parachute, withdrawal reflex, and tendon reflexes are general body reflexes. Facial reflexes, nasal, blink, doll's eye reflex, auditory orienting reflex, pupillary reflex. These are facial reflexes. Oral reflexes, rooting, sucking, swallowing, gag, and cry are oral reflexes. Other reflexes, glabellar tap reflex is other reflex. Glabella.
Tapping.
Clinical relevance, neurological or pediatric assessment in both adults and children. In normal individual, most of the reflexes disintegrate as the age progresses. Presence of these reflexes in older children is considered as abnormal. So that's the basic concept of neonatal reflexes. You can stop them.